Hi, good morning. Okay, let's go ahead and go to the slides. Barbara told me this morning, she kindly introduced herself, told me that she was really looking forward to my words of wisdom, and that number two, she would cut me off at exactly 45 minutes if I started to go over time. So Barbara, if I have any words of wisdom, I'm going to try to get them in early. She said if I go on too long, she'll start walking toward me. And she didn't say what would happen when she gets here, but I don't think I want to know. So I'm going to go right into it. So I realized that I, in fact, am preaching to the choir. And I would say, as someone who's done just a little bit of preaching, there's no one better to preach to than the choir. They pretty much have to pay attention. And they can't sneak out the back because they're in those robes and everybody would notice. And what I want to do in the 45 minutes is really go over things that you know from your own experience or maybe intuitively, and things that are going to be illustrated by a lot of powerful stories and examples today. And I won't have time to tell a lot of stories and examples myself, but what I feel like I'm doing is just presenting the framework or the context or the picture frame within which other people will paint the picture. And the context is, what is mental illness and what are some basic things about mental illness? And especially, what is some of the amazing and I think, for me, mind-blowing research that supports what you already know from your experience about mental illness, but it supports it in a really powerful and I think difficult to doubt way. So before the research, I realized early this morning at 5 a.m. that I did a whole talk about mental illness and I didn't say what mental illness was. And I know you know, but I thought I would just specify in the very beginning what I'm talking about when I say mental illness. So it's a type of mental illness, it's a subtype, and it's a type that affects the brain. And it's based on a physical dysfunction of the brain, and it causes people not to be their normal selves. They're not able to function in their normal manner, and that can be changes in feelings, emotions, changes in thinking, or changes in behavior. And as has already been said twice, and this is the third time, mental illness is not a matter of won't. It's not a matter of your choice, your attitude, your decisions. It's a matter of can't. Just like every other time you get sick, you would very much like your blood pressure to be normal, but it's high. You have diabetes and you want your blood sugar to be normal, but it's high. You can't, by willpower, just lower those things and automatically dial your body down. Now, you can do things indirectly that we'll talk about that will help your body be more healthy in a very powerful way. But those are indirect things that we can do. We can't just get up in the morning and say, I think I'll keep my blood pressure down today, I think I won't be depressed today, or I think I'll keep my blood sugar in a nice range of 70 to 80, even though it was up at 200 yesterday. So examples of mental illness, there are many, many of them. That's because the brain is so incredibly complicated and does such amazing things. So the brain can do many things, and each one of those things can go wrong. But some of the more common ones, again, I think you're familiar with these. Major depression, bipolar disorder, manic depression, schizophrenia, where people hear voices or have other problems organizing their thoughts and behavior. Obsessive compulsive disorder, like the boy who couldn't stop washing his hands, for instance. Anxiety disorders like panic and worry. Substance abuse problems like addiction, many, many more. All right, so first, mental illness is common. It's also already been said that mental illness is very isolating. When you have a mental illness or when you have a close family member or person in your life with mental illness, it really feels very isolating, and it feels like you're the only one, and it feels and it is very hard to reach out. And so you feel like you're standing still and everybody else and all of the rest of life is passing you by. And especially if you ever look on Facebook and you have a mental illness, you see that everyone else is having the best day of their lives. They got up and ate the best breakfast ever and took a picture of it. They're looking younger and more beautiful than ever in their photos. And their kid just graduated from Harvard and won the Nobel Prize in the same day. And you feel horrible and alone with mental illness, and you feel like a failure. So how alone are you? Well, we have great studies. I mean, not only do they cost a lot, which I guess is not surprising, they interview thousands of people in depth. They go knock on doors. These studies take years to do. We have multiple studies in America. How common is mental illness? So let's take, for the instance, the question of, suppose, or the question of all people in America, at some time in their lives, what percentage of people have had some mental illness? One of these, or maybe another mental illness, may be severe and go on for decades, or it may be relatively mild and only last a couple of months. How many people have had at least some addiction or some depression that wasn't just worried well, but was a true illness and dysfunction? And as a psychiatrist, before these studies, I would have said, well, maybe 15 to 20%. Maybe a huge number would be 25%, but I'm biased. I see the people with mental illness, so it's hard to know about all the people I don't see. Well, the actual number of one of these studies is right here, and it's a lifetime prevalence of 46%. 46%. That's almost half of the whole population at some time in their lives has had a mental illness. Some people, it may be they had alcohol abuse and got into trouble in college, but it never came back. Some people may have had depression for, say, 6 months, postpartum depression, for instance, and it went away. Or some people may be depressed for the long term or have other mental illnesses. But half of people have a direct experience of mental illness in themselves. And if you look at the last year, and I'm sorry I don't have a pointer, but that second bar that's green, 25% of people have had mental illness themselves in the last year. 1 in 4 people. Staggering. And if you take a look at that last purple bar that says 5.8%, that's the number, 5 to 6%, who in the last year have been disabled by mental illness. So that's severe mental illness. And when you think about in the general population, 1 in 20 people right now is disabled by mental illness. If you're like me, it blows your mind. And I see this stuff every day. This research was so mind-blowing that as soon as they did this big multi-million-dollar, years-long nationwide study, they turned around and did it again and did a replication study and did everything over again. And I don't know why, but I think they, like me, were wondering, okay, these numbers can't be this high. So they did the next study. They were even more careful. And actually, do you think the numbers went down or went up? Oh, yes, they went up. And so I've got a range from several nationwide studies here, but some of the more recent studies actually show higher numbers. Half of people or more have mental illness in their lifetime, a fifth to a fourth in the last 12 months. Mood disorders like depression, a 20% lifetime rate. Substance abuse, 1 in 3 people will have a substance abuse disorder at some time in their lives. Mental illness is common. And these, again, these are not worried well. This is actual mental brain dysfunction. It's so common that I can walk not into just this room, but I can walk into any room, anywhere, anytime, and I can know that everyone in that room is affected by mental illness, whether they know it or not. So 1 in 2 people will have it. That is so common that either you've experienced it yourself in some way, or you know someone close to you that's experienced it. Again, you may not be aware of that, or you may be in denial about it, or you may not want to talk about it, but I guarantee mental illness affects everyone in a very direct and personal way. And me too, not just in a professional way, but in a personal way. So mental illness is common. Some people say, well, that's you psychiatrists. You just sit around a table, make up some new illness like, oh, I don't know, video game addiction, and suddenly half the population's sick. So is mental illness even real? Are we just kind of making excuses for people? Well, this is a long-running argument. In its present form, it goes back to about 1960. I'm proud to say that's before I was born, but not by much. This psychiatrist named Thomas Szasz wrote a book called The Myth of Mental Illness. So what he said was, look, mental illness is not a disease, it's not a medical problem, it's a personal problem, and what people need to do is take responsibility for their problems and not blame it on an illness, because that just sidetracks people from really getting down to brass tacks with what they need to do in life. So this, a quick Google search will show you that this book is still quoted with approval by many, many people on the internet, on news shows and periodicals, even PhDs, university professors. There are plenty of people still making this argument that mental illness is not really a medical illness, it's just made up. So you would think we don't have to debate this, but I think it's worth talking about, even though, again, all of you already know mental illness is an illness. So how would you know if something is an illness? Well, I'm going to go down the list of some things that occur to me about deciding if something's an illness. One is it a bodily dysfunction that can kill you? I think a bodily dysfunction that can kill you is probably an illness, so we'll look at that. Can it disable you? Can it keep you from functioning in your normal way? That could be an illness. Does it perhaps shorten your lifespan? Well, that might be an illness. And finally, can we actually look inside the body and look inside the relevant organs and see that something is wrong and something is dysfunctioning? Can we show it on x-rays and lab tests? And I know you already know the answer to all of these is yes, but let's look at the statistics because I think they're very powerful. All right, how often does mental illness cause death? I'm going to talk about this in a couple of ways. This is a very sad and depressing topic, and the statistics are even more sad and depressing, but it's very, very important to know about, and very, very important to have these statistics at your fingertips. And by the way, nobody needs to take any notes. There's a very detailed handout with all the information and references posted on the website. So when we think of suicide, which is not, it's not 100%, but it's close to 100% of suicides are due to mental illness. And we want to think about how mental illness kills people. Often we think of teenagers and young adults. And so, just as people would think, in that teenage young adult age group of 15 to 24, as you can see on the slide, suicide is the number 2 cause of death. Number 2, and the only thing that's above it is accidents. And as the bishop was saying earlier, sometimes suicides are officially recorded as accidents for a lot of reasons, sometimes good reasons. So we know it's at least the number 2 cause of death. What really shocked me was when you go into the adult category of 18 to 65. So, well, I'm not 65 yet, so I'll say that's your prime adult years, 18 to 65. How high does suicide rank on the list? I would have said, before I knew the statistics, maybe 10 to 15, and 10 to 15 on the list is a huge public health problem. Well, suicide, as you can see there in red, is number 4. People 18 to 65, all people, it's the number 4 cause of death. That is staggering to me. Staggering. It's a huge public health problem. It kills many more people than AIDS, for instance. It kills almost twice as many people as murder, confirming that we are more dangerous to ourselves than anyone will ever be to us. Kills more people than, say, strokes or diabetes. What about over 65? Well, suicide does drop down on the list somewhat. That is not because people over 65 don't kill themselves. And in fact, people over 65 are more likely to kill themselves even than teenagers. But what happens is so many other causes of death step up, so to speak, and bump suicide down on the list. So if you take everybody, basically all ages starting age 1, suicide is still number 10. Again, a profound public health problem. Mental illness is profoundly life-threatening. All right, what about disability? Say it doesn't kill you, but it stops you from functioning normally. How do we track this around the world? We track it in people not being able to do the work that they've previously been able to do. So is mental illness disabling? Well, again, I don't even have to ask. I know you know the answer, and I know your eyes are going right to the top of this graph. And the top bar is in orange, and that's neuropsychiatric disorders. So if all medical problems in the U.S., guess what? Neuropsychiatric disorders cause the most disability. More than back pain, more than arthritis, more than diabetes and strokes. Well, sorry, strokes is in the light category there under neurological disorders at the end of the bar. Even if you take out neurological disorders and just leave mental illness, which is the dark orange, you can still see it's the #1 category of illness causing disability. And furthermore, if you break down categories of mental illness into individual illnesses, guess which individual illness causes more years lost to disability than any other illness in all of medicine? Anybody want to guess? Right, I hear people whispering it. Major depression. The one single illness, and this statistic is worldwide, by the way. It's not just in America where people are wimps and people might not want to work. No, worldwide, even where they don't have psychiatric diagnosis or don't know what depression is the #1 cause of disability. Finally, what about not killing you directly, but maybe shortening your life? For instance, maybe a disease is hard on your health like diabetes and may cause your health to deteriorate and may sadly cause you to die earlier. Can mental illness do that? You can see from the slide and the tone of this talk that yes, it does. So the severe disabling category of mental illness, which remember is about 5% of the general population, 1 in 20 people, studies we have so far say their lives are 25 years shorter than average related to that mental illness. 25 years off your life. Again, it's staggering. And even if you don't take the most severe cases, but you talk about just everyone with bipolar, everyone with schizophrenia or depression, you still have amazing numbers. Bipolar taking 10 years off people's life on average. Schizophrenia, 12 to 15 years. Depression, I couldn't get a number in years, but it basically increases your chances of dying by 80% in any given time period. Now that doesn't mean you have an 80% chance of dying in any time period, including the next year. It means if your chance of dying is like 0.05% for this next year, it's going to go up by 80% if you have depression, which if you're an individual doesn't make a huge difference, but if you look at the millions of people who have depression, this makes a huge difference in people's lifespan overall. Mental illness also makes other medical illnesses worse, and I'm going to stick with depression for a lot of these examples again because of time. So if you have depression, you're more likely to have heart attacks. Did you know that? If you have depression, you're more likely to have strokes. If you have depression, you're more likely to get diabetes. If you have heart attacks and then you have depression on top of that, the depression doubles your risk of dying of another heart attack. Now again, these are sobering, staggering statistics. I know lots of people in this room have had depression. It doesn't mean you're going to have a heart attack. Depression is one of many factors, like how much you exercise, how your diet is, how much stress you have, that affects your heart health and your bodily health. My point about it is, even major depression, which we don't always consider as, quote, biological, as something like schizophrenia, has profound effects on the whole body. So I want to go on to illustrate that. But one comparison that I heard that startled me was a researcher into heart disease and depression who said, it's not proven yet, but I'm beginning to think that depression is as bad for your heart as smoking is. So, all right, so can we look at mental illness and see if is there something biologically there that we can put our finger on and say, okay, this is going on in the brain and body, this is going wrong. Just like if somebody has a broken leg, not only do they hurt and refuse to walk, but we do an x-ray and we see the break in the leg. Well, back in '61 when that book, Myth of Mental Illness, was written, no, you couldn't do that. So this psychiatrist named Saz, he was a very smart man. He was saying, look, you can't prove this. Show me the money. Show me the actual disease. People with mental illness, again, sorry to be morbid, but doctors are, they may die of whatever cause. You look at their brain. The pathologist looks at the brain. In 1961, the pathologist can't tell any difference between the brain of, say, a depressed person or a person with bipolar and a person who doesn't have it. So Saz says, well, this can't be a real medical illness. Well, now, can we look into people's brains? You bet we can look into people's brains. We can look in their heads while they're still alive, and we can see the precise shape of somebody's brain who has a mental illness, and we can see the precise way that the brain is functioning, and we can see ways that the functioning of the brain and the shape of the brain changes with mental illness. And if Barbara wasn't such a stickler about time, I would give you lots of fascinating details about head scan studies. But instead, I'll blame Barbara, and I'll have to move on and brush over some details. But these are from depression. And you can see on your left, that's a, quote, normal brain. I don't know what normal is as a psychiatrist. That's a normal brain of somebody who doesn't have depression. And you can see it's like weather maps. It's kind of a heat map. And you can see there's a lot of activity in the front of the brain, the left-hand side of the brain. And it's orange and it's yellow. And if you look at the chronically depressed brain on your right, you can see the front of that brain is lighter colored. So it's like a weather map. And basically, this is showing from an actual head scan that if you have chronic depression, the front of your brain is less active. And that corresponds precisely to what we know about the brain and what we know about depression and what it does to people, which is it affects those brain functions that you see in the frontal lobe, like it slows you down, it makes you think and talk slower, it's hard to make decisions when you're really depressed, it's hard to focus and concentrate, it's hard to make yourself do stuff, it's hard to plan decisions and execute the plan. All those functions are in the frontal lobes, and as people have those depressive symptoms, we can see decreased activity in the front of their brain. And there are changes all over the brain and body with depression. This is just one example. And we can also see, interestingly, that these things normalize with treatment. Whether it's a treatment with talk therapy or medication or anything that makes somebody get better, we'll see these brain abnormalities get better with depression. So physically, with chronic years-long depression, there's even some shrinking. It's small, but there's some measurable shrinking of the frontal lobes in depression. You'll be happy to know that that gets better as people recover from depression. But we can now answer the challenge of Thomas Szasz and the myth of mental illness, and we can point to exactly where mental illness is in the brain and what's going on in the brain. No time for examples, but genetic studies. We can show how genes set people up for mental illness. Neurotransmitters, serotonin, dopamine, norepinephrine, the chemical messengers of the brain are very different and abnormal in different mental illnesses. Hormones. Did you know mental illness changes hormones all over your body? One example is that in major depression, you have elevated levels of cortisol. Cortisol is a stress hormone, but it also does two other wonderful things. It raises your blood sugar and it makes you gain weight. It's part of the joy of depression for many people. Some people lose, but a lot of people gain weight. Well, if you're gaining weight and your blood sugar is high, you're at a tremendous risk for diabetes. So you remember I said depression is a risk factor for diabetes. This is part of why depression is affecting the whole body. Here's another example, inflammatory function. There's an inflammation system all over our body to fight off infection. That inflammation system is revved up in depression, not just in the brain, but all over the body. And when there's more inflammation all over the body, including in the circulation, guess what? Very sadly, when there's more inflammation in the blood vessels, there's a higher risk of stroke and heart attack. And I already showed you that stroke and heart attack are more common in depression. So what's my point? My point is that mental illness, depression is one of these mental illnesses that I'm using as an example. Mental illness changes not just your mind, it changes your brain and it changes your body, and it's frighteningly biologically real. It's not just provable, it's frightening how real this is. So it's definitely not all in your head. Don't let anyone ever tell you that again, even a doctor. The evidence is so overpowering. I mean, there are hundreds of studies for every one of these individual points I'm making that it's not really a debate anymore in scientific terms. It's not a debate in med schools. All this stuff is just understood. There are people, like I said, still arguing on the internet. I suppose that will go on forever. Maybe some people have already made up their minds and for their own reasons don't want to consider new information. Or maybe some people just haven't gotten the memo, haven't heard about these amazing studies that make it absolutely clear mental illness is real. It's common, real, disabling, deadly, hard on the body as well as the brain. It takes years off your life. Are you feeling really good now? Are you feeling really encouraged? You know, in one way it's a relief because if you have it, you realize, okay, I'm not making this up. Not only am I not making it up, If I have serious mental illness, it's amazing I'm making it through the day. Just existing is a huge challenge. My hat is off to people who can do that. I see people every day that I'm convinced I would not make it. I would not survive some of the things that they are able to survive. And of course, not everybody is able to survive. Part of having a real medical illness is that in medicine we have treatments, which I'm going to talk about in a minute. But in medicine, we can't cure every case of cancer. And we still have people dying of diabetes and high blood pressure and heart attacks, even though we have good treatments for these. So I was told in my psychiatric training that, look, you're in a branch of medicine and there will be people that you cannot save. Even if you're the perfect doctor and the patient is the perfect patient and the family is the perfect family, tragically, sadly, gut-wrenchingly, some people will die of these illnesses because medicine in our century is good, but we don't cure everybody. Still, it's a little depressing, kind of makes you feel helpless at times. Believe me, I know this feeling. So is there any good news? Is there any hope to hold on to? Is there any reason we can look in the mirror of mental illness and feel good about ourselves and our future? Well, just seeing this picture makes me feel a lot better. But I think there are also very substantive reasons why we can feel better too, and I'm going to present 3 of them and then wind up, Barbara. All right, so mental illness is nobody's fault. Mental illness is not a spiritual problem, and mental illness is treatable. All good things to me. This one I really like. Why do I like this? Why is this good news? Well, human nature is, and I guess dog nature is, we just want to blame someone else when something goes wrong, right? There's a scandal in Washington, something bad happens, a bridge falls down, really bad things happen. Part of what we do is try to fix it and make it better. Part of what we do is we decide who to blame as human beings. And sadly, since mental health treatment is a human undertaking, my field has had its share of the blame game in it. So one of the worst things my field ever did was blame parents. You know, when in doubt, blame the mother, right? What are mothers for? She still won't reject you even when you blame her. So we had this thing in the 50s and 60s in my field called the schizophrenogenic mother. Sounds very official and very medical. Basically, the idea was that mothers gave their kids the wrong messages over and over and over, and that literally drove their kids crazy and gave them schizophrenia, and so it was the mother's fault. Now, I'm happy to say this was abandoned 40 to 50 years ago. All mental health professionals are ashamed of this theory today. I apologize if you've ever heard of this theory or ever been blamed for a mental illness, because I promise you, no matter what your kids say about driving them crazy, you could make it your life's work to give one of your children schizophrenia and do everything in your power, and you still would not be able to give your child schizophrenia. Schizophrenia is not about bad raising. You may make mistakes as parents. I make a mistake. Well, my kids notify me every time I make a mistake, but it's really often. But whatever mistakes you make, whatever harm that does not cause mental illness. And, you know, this has affected me personally. One of my children has addiction. The longest hour and a half of my life was the ride up to the treatment center where my son was being treated for addiction, and he was very brave to go in and get treated. I was not so brave. I had the longest hour and a half of my life riding for one of those beloved family weekends at the treatment center. And I died 1,000 deaths because I was thinking, I'm a psychiatrist. How could this happen, and what excuse do I have? I mean, other people can show up and say they didn't know, but I'm supposed to know better. And I went over every mistake I ever made with that kid, and all of the ways that those mistakes probably gave this kid his mental illness of addiction. And I was in misery for an hour and a half, excuse me, and parents or family weekend was an all-day event, and about the 7th hour of my suffering, somebody said for the 15th time in a presentation, it's not your fault. And on the 15th time, it finally got through, not just to my intellect, but my emotions, that they were really serious. They weren't just patting me on the head saying, there, they were serious. It's an illness. It's actually not your fault as a parent. And so this is powerful when we can tell people this, and sadly it's powerful when they get blamed. Well, I won't whine a lot about doctors getting blamed for mental illness. I've already referred to that. Many psychiatrists have the reputation of being pill pushers. All I can say about this is I know a lot of psychiatrists. Some of them are admittedly kind of weird. I admit, we're a weird bunch. You all know that. Every psychiatrist I know is trying every day to get people into talk therapy. I don't know any psychiatrist who thinks all you have to do is take a pill and that's going to fix anything. And I don't know any psychiatrist who wants to put you on as many meds as possible, because all psychiatrists know that these meds are powerful, but they're also risky. And the more different meds you take, and believe me, sometimes you have to take quite a few, the more risk there is to these meds. So psychiatrists appreciate this, but I'm not going to whine as a psychiatrist, because when in doubt, what do? We blame the victim when it's the blame game. So people with mental illness have been blamed more than anybody else for having the mental illness. Can people in the back nod real big if you can read this, or shake their heads if you can? Okay, not everybody can. Okay, so this is helpful advice. This is what people say about mental illness, but putting it in context of what if they had a medical illness. So the person's lying there shaking and barfing, and the helpful friend comes up and says, I get that you have food poisoning and all, but you have to at least make an effort. Or the person on the right, the hand's cut off and bleeding, the helpful friend says, you just need to change your frame of mind. Then you'll feel better. My favorite is the bottom right corner. The guy, that's a person giving themselves a shot for diabetes, so they're getting their insulin injection. Helpful friend comes up and says, I don't think it's healthy that you have to take a medication every day just to feel normal. Don't you worry that it's changing you from who you really are? So to me, treating mental illness this way is like somebody shows up at the emergency room with a broken leg, and we say, you know, we'll look at this leg and all, but it's obvious you really wanted to break your leg. I mean, really, you had a bad attitude, you weren't paying attention, that's why you slept in the shower. You really wanted this, and if you wanted to, you could just get up and walk out of here. But it's okay, we'll treat you. Nobody thinks that about a broken leg, and I have yet to meet anybody. There may be a few people who wanted to break their legs, and there may be a few people who wanted mental illness, but I've spent many, many years doing this all day long, and I have never met anybody who really, truly wanted their mental illness. So blaming the victim is, of course, what we're not here to do. Let me move on, just say a little bit to play devil's advocate, which obviously I think this is ridiculous, but to play devil's advocate, okay, why not blame people with mental illness for their illness? For instance, addiction. Okay, you're an alcoholic. Well, if you never drank alcohol, you would never become an alcoholic. So aren't you responsible in a way for developing your mental illness? I can tell you as a psychiatrist, if you never got stress, you would never be depressed. Yeah, exactly. Because stress is totally normal. So everybody gets stressed, and even though that's a risk factor for mental illness, everybody has stress. Furthermore, everybody has bad habits in life. Not everybody smokes cigarettes, not everybody drinks alcohol, but everybody has stress, and people have different bad habits. Some people are, say, workaholics, some people are perfectionists, and some people are couch potatoes, or like me, would like to be a couch potato. Some people have an enormous weakness for Andy's frozen custard. And I'm not going to name names or throw anybody under the bus here, because this is not about blame, but we all have our bad habits. So if we point to people with mental illness and say your bad habits gave this to you, it's like they say in Alcoholics Anonymous, you point the finger at somebody else and three are pointing back at you. We've all got these bad habits, and we've all got bad habits that can give you physical or mental illness. So the fact that you have a bad habit is just being a person. That doesn't mean that's responsible for the illness. What happens is, because of genetic weakness and other developmental factors, a bad habit or a bad decision or just being in the wrong place at the wrong time will play into developing a mental illness. But the actual mental illness is when something breaks in the brain. Just like an actual regular illness, even if it's as simple as the flu or a common cold, it's something's going wrong and breaking down in the body. And that is not a bad choice. That's not a bad habit. It's not a bad attitude. It's a physical dysfunction that we don't control. We don't make it start by willpower, and we can't stop it by willpower. All right, so mental illness is not a spiritual problem. I could not figure out a simple, time-effective way to explain this, so I'm going to have to be very brief here. Again, I know all of you know that mental illness is not from a lack of faith, it's not from a lack of praying, and it's not from a sin that God is punishing you for. There are still people, at least on the internet, claiming that mental illness is a sin or it's a bad habit, or you can do this from a kind of New Age perspective and say if you just had the right dreamy attitude and the right vibrations, you'd never be sick with mental illness. We know this is wrong. We know that human nature tells us we need to blame something for this, and I blame dualism. Something probably you've never heard of, or if you ever heard of it, you forgot about it immediately. Dualism is the belief that people are composed of two separate substances, a physical body and a non-physical mind or soul or spirit. And so if you're a dualist, and you may not know you're a dualist, but if you're a dualist, you think something is either physical or it's non-physical. And so the problem with dualism, which has been around a long time in Western history as an assumption, is that if somebody gets a mental illness of their emotions, thoughts, or behaviors, well, that's mental. That's not a physical illness that you go to doctors for. That's a mental illness, and you need to change your thinking. You are, quote, responsible for that in a way that you're not responsible for a physical illness. And what I'll say about this, and again, I apologize, I don't have time to really explain it all, is I don't think that's a model that goes along very well with the science that we have, and I don't think it's a model that actually goes very well with the scripture that we have if you're a Christian. And there is no biblical model for the human person in terms of something that's explicitly presented, but this model I have on the right here is one that I think is consistent with Scripture. And it's still fairly simple. It says you have a physical body and you have a non-physical spirit. And the non-physical spirit, God is spirit and not physical. We have spirits with which we can relate to God. But in between that is a level of soul or psyche. And your soul is both mental and physical. And this is what science says, and I think this is really what Scripture implies. That when we have thoughts or feelings or behaviors, something is happening mentally, but something is also happening physically. And so when something breaks physically in the brain, you bet it's going to change things in our minds. And a very simple example of this is if you get hit on the head hard enough, you lose consciousness. And I know that's rather obvious, but it's an example of the physical and mental going together like two sides of the same coin. They always go together. So mental illness is not either physical or it's mental, like on the dualistic side. It's always both mental and physical. And the fundamental problem, the fundamental cause of mental illness is the physical side of that coin, and it pulls down the mental side. But part of the good news and part of the answer of, well, what do we do about it, is that you can pull people up from mental illness on the physical side with biological treatments like medicines, but also on the mental side with mental treatments like talk therapy. So I'm going to go on and talk about the treatability of mental illness. What do I mean by saying it's treatable? I'm saying that mental illness is treatable exactly as treatable as most disorders are in most other medical specialties. And this one surprises even doctors, but we have some good recent evidence on it. Now, when I say treatable, I'm not saying curable, and I'm not saying that on purpose. It's not that no one gets well from mental illness. I see a lot of people that get completely well, and I tell them, when you get completely well, I'm going to be the second happiest person on earth, and you'll be the first happiest. And I see people get all the way out of mental illness all the time. So it's possible, but it takes a long time, and it takes a lot of work, and it takes a lot of luck or a lot of blessing to do that. And it doesn't mean we can cure it like somebody shows up, I don't know, with an ear infection and you take an antibiotic for a week and the ear infection's gone. There are a few kinds of illnesses that medicine can cure rapidly and directly like that, and those are called acute illnesses. And there's a secret among doctors that I'm going to tell you that's very interesting about why we're able to cure acute illness. Acute illness is your normal self. It comes on quickly, and then you cure it, and it goes away quickly. But the secret is acute illness, as long as it doesn't kill you, is actually going to go away quickly on its own. So if you have an ear infection, it's going to really, really hurt, and you'll be miserable for a couple of weeks, but you'll get better even without antibiotics. Now, antibiotics keep you from having complications. They keep you more comfortable. They make you get better faster. But acute illness resolves itself. If you break your leg is going to heal with or without treatment. Now, it might heal really wrong in a bad way if you don't get treatment. I'm sure going to go to the ER with a broken leg, but it will heal. That's acute illness. Acute illness is not most of illness in medicine. Most of illness that's seen in clinic and hospitals is chronic illness. That's an illness that doesn't kill you right away, but it stays with you. It's not self-limiting. And interestingly and sadly in medicine, there are very few chronic illnesses that we know how to cure. All right, so diabetes is a chronic illness. Can we cure that? No. High blood pressure? Nope, don't have a cure for that. High cholesterol? No. Arthritis? No. Multiple sclerosis? No. Lupus? No. Migraine headaches? No. On and on and on. We have good treatments for every condition I mentioned, and I'm grateful to have them. But we don't have cures, and so the exact same thing applies in psychiatry. Here's just a graph showing that 85% of medical treatment or money for medical treatment is spent on chronic illnesses, only 15% on acute illnesses. The point is that most illness that most doctors of all specialties treat is chronic. So here is something that looks like a lopsided Christmas tree. And it's a graph, and as you go upwards, those dots are saying that this treatment is more effective, and as the dots go downward, where the dot is saying that that treatment is less effective. And so what somebody did, who was very energetic and very enterprising, is they said, well, I'm going to compare all these medical illnesses like migraines and diabetes and high blood pressure and heart disease and arthritis, and see how effective our treatments are for those medical things, and then I'm going to compare them to how effective our treatments are for mental illness. And so the white dots are all those medical conditions that aren't mental illness, and the blue dots are the treatments that we have for mental illness. So there's a lot more white dots because there are a lot more medical illnesses that get treated, and there are less blue dots, and the blue dots are clumped together a little bit more. But you know what happens when you average out all those dots and you draw a line to say, well, how effective are medical treatments and psychiatric treatments compared to each other? If you draw that line, it's actually in the same place. It's between 0.4 and 0.5, which says that medical and psychiatric treatments, on average, are all moderately effective for chronic diseases. So this is a very sophisticated statistical analysis where they pooled together hundreds and hundreds of studies. And what do we know? We know that mental illness is as treatable as other medical illnesses. So it's sobering that we can't cure it, but also people should be no more in despair with mental illness than they are with, say, diabetes, where we have a lot of good treatments and we have a lot to work with as long as people can access the treatment. Okay, good treatments. Psychotherapy, medication, those are the two most proven treatments for every mental illness, every major mental illness. We have we have hundreds of studies showing that talk therapy works and that medicines work. It's not one versus the other. They work better together than they do separately. We have bunches of other treatments. We have other biological treatments. I've listed some of the mental, social, psychological treatments here. All of these have scientific support for them. And believe me, or you already know, we need them all. It's not just, well, I just want to exercise and take care of my mental illness. definitely exercise. Do everything else that you think might help that mental illness. So, talk therapy, exercise is good for the brain in specific mental illnesses. 12-step programs for addiction are very powerful. Prayer and meditation. There's actually good scientific evidence that both of those are good for your mental and physical health. There is a huge amount of scientific evidence, a surprising amount, that going to church every week and being a person of faith has strong effects on your mental and physical health. Really amazing. So there are a lot of things we can do. We're not at a loss of what to do. It just takes a long time and a lot of patience and a lot of perseverance to access and make use of mental health treatments, both for patients and families. So I'm going to end on this. I got 2 minutes. I got the full version on the handout that I invite you to look up. Really, what this is a thank you to people who have mental illness in their families. This is what I do all day. I sit in an office. I sit in one chair. And my body gets very tired, but my mind never gets tired of listening to people and their families who have mental illness. And I can tell you that most of the important life lessons that I've learned from them, and most of what I know about psychiatry, if not all, my patients have been, patient enough to teach me. And I want to say that my patients, as you well know, they're normal people. Because normal people have diseases, and normal people have problems. But I think that most of my patients are abnormally wise because from a very young age with mental illness, usually before the age of 20, your mental illness is beginning, and you have to face limits of life, you have to face very hard challenges, you have to face very dark nights, you have to face things that make other people despair, and you have to develop humility and tenacity and inner strength and wisdom. And so I'm very grateful, and I admire very, very much the people I see in my clinical practice. So yes, we're all tired already, but thank you for your kind patience. And Barbara, I am done.